From insurance-driven private healthcare to equity. The article is taken from the newspaper The Hindu, which is talking about India's needs to balance insurance schemes with strong public health investments for affordable health. We know that the inequalities are persisting in the society and in the economy in all aspects. Therefore, to make the healthcare more inclusive, we need both the insurance schemes as well as strong public investments in the health. And we know that the SDG goal 3, which is talking about the health to everyone, that is ensuring healthy lives to everyone at all time, is very important. Therefore, maintaining this balance is also important to achieve the SDG goal number 3. So let us discuss more about this article from the mains point of view. So first we are going to see what are the problems associated with this insurance driven healthcare system. The first is a high out of pocket expenditure. That means even though there is a strong insurance policy, still we can see that 48% of the total health expense is still coming from the pocket of the people. And the next is limited coverage. We know that the government of India introduced this Ayushman Bharat Pradhan Mantri Jan Arogya Yojana in the year 2015, which provides universal health coverage to everyone. But still, large segment of the people in the society are still remaining uninsured, and there are also problems associated with claim rejection. We know that this will happen in both the government insurance schemes as well as the private insurance scheme. That means if the government, if the people are not insured in the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, they might have made insurance in other private companies. The problem is that certain hospitals will not accept certain insurance companies. So this type, and that will result into claim rejections and other issues, and this will again leads to high out of pocket expenditure from the people. And the next is fragmented system. That means different companies have different policies, therefore the benefit will be inconsistent. And the next is rising premiums. We know that the insurance companies are driven by the motive of profit. So therefore, due to this changes in the economy, for example, due to the inflation and such factors, the private insurance companies will go for higher premiums, and this will only benefits the employers rather than employees. And the next is focusing on curative over preventive care. That means the insurance-driven healthcare always focuses on curative model of healthcare rather than preventing the disease or the conditions. And what are the challenges in the India's healthcare system? First is the underfunded public health system. That means we are spending only 2.1% of our GDP for the healthcare. But you can see that this is much lower than the global average. That means according to the WHO, in the year 2021, the world spent around 10.3% of the global GDP for health. But you can see that India's even today also India is spending only 2.1% of the GDP for the public health. And the next is rural-urban divide. And the next is urban-rural divide. That means 70% of the people lives in the rural area, but only 40% of the healthcare professionals are working there. And the next is high disease burden. That means India is currently facing the problem of both infectious disease like tuberculosis, and on the other side non-communicable disease like cardiovascular issues, diabetes, hypertension, like that. And we can see that since 1991, since the period of LPG, the rising cases of non-communicable disease is getting higher, right? And also we can see that 60% of the fatalities are related to non-communicable diseases. And the next is expensive private healthcare. We know that the private hospitals are always costly, and the price, there is no fixed price. So for example, in one private hospital the price will be for example 10,000 per consultation or for treatments. On other side, large hospitals, they will ask for lakhs and sometimes even crores. So far we discussed what are the challenges in the insurance driven healthcare system, and then we discussed what are the major challenges in India's healthcare system. So what are the solutions can be given to address this problem? First one is increasing the public health spending. That means we have to spend at least 3% of the GDP for the public health. And the next is strengthening the primary health care. We know that the more PH. And the next is strengthening primary health care. That means introducing more primary health centers in the rural area, and making sure that more professionals are available there, and also digital health solutions. That means tracking the person's health. We know that the Saksham Anganwadi scheme, for example, the government introduced the Saksham Anganwadi scheme, and the Saksham Anganwadi scheme tracks the health of the women and the children digitally. The next is expanding the universal health coverage. That means including outpatients and diagnostics into consideration. And the next is boosting healthcare workforce. That means introducing more medical colleges and making sure that more people are working in the rural area. So far, we know that only 40% of the healthcare workers are working in rural area, but 70% of India's population is still in the rural area. So this type of disparities has to be addressed. And the next is promoting preventive healthcare. That means this is one of the major issues, like and the next is promoting preventive healthcare. That means going for immunization. We have the project Indradhanush. And the next is lifestyle awareness. That means we have Life Mission, which works for promoting the sustainable way of lifestyle for the people. And these type of initiatives are already taken by the government, but we need to strengthen it. And the next we can also see that recently the government introduced a tertiary cancer. And we can also see that the increase in case of non-communicable disease is a burden. So therefore, the government in this 2025 budget, they strengthened the tertiary care cancer facility scheme. That means it will under the scheme, the government will provide fund for setting up state cancer research centers and the tertiary cancer research facility care facility. So these type of initiatives have been taken recently, and this is working. This scheme is coming under the national program for the prevention and control of diabetes, stroke and cancer, and that is working under the National Health Mission, which was launched in the year 2005. So you have to note some of the recent initiatives taken for the health in the Union Budget 2025. You can use that for writing answer in the coming mains. And I hope you understood this topic, and with this we will discuss a mains question. The question is, critically analyze the role of insurance driven healthcare in India, suggest measures to strengthen public health investments. So critically analyze means what are the challenges associated with the insurance-driven healthcare system in India. We discussed what are those challenges in the first slide, and the next is suggest measures to strengthen the public health investment. So try to answer the question, and it is a 10 marks question, and you have to write around 150 words. Try to answer it, post it in the comment section. We will review and we will reply for your answer. Now it's time to move to the next topic.